The first step in any research project is to clearly define the research question, since it will be the basis for developing and conducting the research project. There are different criteria that define a good research question. The best research question is one that attempts to fill a knowledge gap in the literature, enough to be answerable and researchable, and should be relevant to the study's objective, should avoid duplication of previous work, should be feasible and cost-effective. The question should be doable within a specified time frame allocated for the research project. Moreover, it needs to meet the minimum ethical standards. The researcher can formulate a research question through different means. Literature reading might help a researcher identify the areas that need further study, and thus a hint towards a research question. Another method is patient observation through clinical experience, which might pose different researchable questions. The question could also raise from previous research, journal clubs, or conferences. A well-built research question should include 4 elements, referred to as BICO, that identifies the key elements of a research question that need to be addressed. The BICO concept is important in narrowing down the research question, providing terms to search and saving time in searching literature. The P in BICO stand for patient or population. The first step in BICO is to identify the population to be studied. More specifically, it describes patients' characteristics, such as age, gender, and disease status. The second step in BICO is to identify the intervention to be tested. It's important to identify the exposure intended to be studied in the research project. This may include the use of a specific diagnostic test, treatment, adjunctive therapy, or medication. The third step in BICO is comparison, and it is the alternative exposure to which the intervention will be compared, which might be the standard of care or placebo. The last step in BICO is outcome to be measured as a result of the intervention. It's the evaluation of the intervention's effect. This may include the cure or level of control of a disease or efficacy of a medication or a diagnostic test. On the other hand, there are different criteria that define a bad research question. For example, it is not acceptable to write a vague or unclear question. You need also to remember that the question should not be too broad to reach conclusive results. You need also to be careful not to choose questions that are irrelevant to the topic under investigation. A bad research question could also be a question that doesn't consider the criteria related to the logistic of the study, such as the time needed to carry out the study, high cost with limited funding, limited resources, such as availability of expertise, special equipment, or information. A research question might also be limited by ethical considerations or requirement of authorities' approval. Now it's time to use the information we have to formulate a research question. My topic of interest is women's health. The narrowed topic, women and cancer. The focused topic, women smokers and breast cancer. BICO, the population, women. Intervention, cigarette smoking. Comparison, no smoking. Outcome, breast cancer. Now, my research question: does smoking among women older than 35 years affect breast cancer risk compared to non-smokers? Thank you for watching. See you next time.